Hi, I'm Jennifer Ligon at Pediatric Partners Evans. I want to talk a little bit about water safety. When summer is near, everybody's getting excited about going to the beach, the pool, the lake, even in the backyard to play. It's very important that you have a designated water watcher or an adult to watch children when they play in water. Children can get injured in just a very small amount of water in a short amount of time. And sadly, I hate to report that drowning is the most common cause of death in children age 1 to 4. So if there's anything I can recommend, number one thing is have an adult present at all times. The American Academy of Pediatrics recommends swimming lessons for children ages 4 and up. We recommend anytime you feel your child is interested, go ahead and sign them up for swimming lessons. Another thing that's very important is just talking to your children from a very early age about swimming safety or water safety. One of the most important things is mentioning to them that they can only swim when an adult is present. Another thing is if they drop a toy in the pool, encourage them to ask for help rather than try to get it, especially if it's near a drain or a gutter. Also, instruct your children if they see another child who's struggling in the pool, throw a pool noodle in and ask for help rather than trying to help the child and them both struggling. In regards to pool noodles and water wings, those are helpful swimming aids, but they're not always sufficient to prevent drowning. Finally, if you own a pool, we recommend self-latching gates and CPR training. The last thing I would like to say is about sunscreen. We know sunscreen is a controversial topic, but as a pediatrician, we would rather you use a chemical sunscreen than have a sunburn. Once you have a sunburn, there's not a lot we can do to help you out. Consider limiting exposure to direct sun, especially between 10 a.m. and 4 p.m. Also, you always want to reapply every 2 to 3 hours. We recommend wide-brimmed hats. We also recommend for babies under 6 months, you can do shade in umbrellas or under trees. In babies and children, you can do breathable, comfortable clothing with a UV protection factor. There's a lot of data about what SPF is appropriate. There are several studies that say that possibly anything over SPF of 50 may not add additional coverage, but we recommend an SPF of 15 to 50. Finally, zinc oxide and barrier sunscreens work better in the more sensitive areas of the face.